Hello and welcome to the plenary, taking on the hard problems, hunger, health, and ingenuity. Also, we wanted to say welcome to our web audience, wherever you are in the world, and remind people that if you are live tweeting, to please use hashtag GPF18. I'm thrilled to be here today, and this panel, as the last people on stage says, is incredibly important. After steadily declining for almost a decade, global hunger is on the rise again. This currently is affecting 11% of people globally. So if we think about the 7.6 billion people in the world, that's 815 million people who are hungry. That means that on a daily basis, people are lacking enough calories and protein to live well and be healthy and thrive. And this is a lethal form of malnutrition. But it's not only the case that people are hungry and malnourished. We have a lot of other problems that feed into this hunger issue. It also stands that more than 40% of the fruits and vegetables in developing regions spoil before they can be consumed. This is due to broken links in the chain from farms to markets. It's also due to crop loss, misaligned financial incentives, the need for greater accountability, and I'm pleased to say that our panelists today are addressing many of these issues, and I look forward to hearing from them about it. On the health side, we've made great strides globally. However, preventable diseases continue to be a leading cause of death in fragile countries. So 1 in 5 children worldwide is not fully protected with even the most basic vaccines. And as a result, 1.5 million children die each year, or 1 every 20 seconds, from vaccine preventable diseases such as pneumonia and diarrhea. We know that vaccines are expensive for the world's poorest countries. There are supply shortages, lack of trained health workers, unreliable transportation systems and storage facilities. All of these feed into the difficulties around preserving high-quality vaccines. I run, with some fantastic colleagues, a center at UC Berkeley. It's called the Blum Center for Developing Economies, and we are an interdisciplinary hub for poverty action and poverty studies. We bridge technology, scholarship, and practice to tackle global problems, and students come to us, to our classes and our programs, our prize contests, our co-working space, wanting to put their education to practice while they're in school. This is this experiential learning that you're hearing so many people talking about. We have students from 55 majors. Maybe it'll be a freshman doing a business degree, or maybe the person that'll come to see us will be a 5th-year PhD student in mechanical engineering. And we get to these people at the early stages of their ideas and their careers, and we try to help them become the researchers, innovators, and grassroots changemakers that these people are today. Our speakers have developed and adopted novel means of advancing food security and health, and many of their ideas started as graduates and undergraduates. With smallholder farms producing up to 80% of food consumed in the developing world, our panelists are working to increase that productivity and efficiency. In hard-to-reach areas, our panelists are offering healthcare services and building health infrastructure that is needed. I'll keep the introduction short since their bios are in the conference program books that we all have. To my left, I have David Lobel. He is Deputy Director of the Center on Food Security and the Environment at Stanford University. He is unearthing richly informative but often underutilized data sources to investigate the impact of climate change on crop production and global food security. He received a MacArthur Award in 2013. Next up, I have Lucia Nkoma. She is Enterprise Development Officer for the Clinton Development Initiative, Malawi. She is responsible for educating the community and training local farmers to set up female farmer clubs to increase women's roles in decision-making. She is recognized as a role model for women and girls and a leader in agricultural development in Malawi and beyond. We have Nithya Ramanathan, CEO and co-founder of NextLeaf, which improves human and planetary health with sensor intelligence. NextLeaf's immunization platform, Cold Trace, currently protects the vaccine supply for over 12 million babies born each year. Nithya is the recipient of the 2017 Hedy Lamarr Award for Female Tech Pioneer. And finally, I have Anushka Ratnayaka, forgive me for not going in order, who is founder and CEO of MyAgro, which deploys a micro-savings model in West Africa to help farmers pay for high-quality seeds and fertilizer to increase both their harvests and their income. Anusha is the recipient of the 2018 Skull Award for Social Entrepreneurship. I'll have you all introduce yourselves, and why don't we go in order, starting with you, David.
Hello, I'm David Lobel from Stanford University. I guess I'll just build off of what you were saying in terms of the trends that I see. There are certainly some trends that are concerning. The last panel was making very clear the point that right now, today, food security is getting worse in a lot of the areas of the world that are becoming less stable or that are mired in instability. But on the positive side, the rest of the world has seen quite significant improvements over the last decades, and you can see examples like Ethiopia, where there's been a major investment in rural livelihoods over the last decade, and you see continued improvement. The other thing that you touched on, which I think has been very clear to me in the last decade, is at Stanford, similar to Berkeley, we have had just an incredible growth in the enthusiasm for these issues among the best and the brightest students that we get, and we've had all sorts of growth in programs bringing in, say, computer science and machine learning experts to work on humanitarian and food security issues. We've had a lot of graduates of both the business school and engineering and elsewhere going on to create new ventures, both nonprofit and profit ventures throughout Africa and the rest of the world. So I think in the long term, I think we're in good shape in the sense that the best and the brightest are really taking on these issues in a way that probably didn't happen 10 or 20 years ago. I'll pass it on. I'm more curious to hear, I guess, what the other folks say.
Sounds good. Lucia, please tell us about what you've been up to.
Thanks. I am Lucia Nkoma from Malawi. First of all, I want to thank Jenny and the organizing committee for inviting me to attend this wonderful conference. Malawi is one of the small southern countries. To the north is Tanzania, south is Zimbabwe, east Mozambique, and west Zambia. I have a story to tell. I came from a family of 8 children. In our community that we are living before I joined CDI, we were facing so many challenges. Because we are many in our family, my parents failed to send us to good school. For us to eat, it was really a challenge. For us to have clothes like this one, it was really a challenge. And most of the girls ended up into early marriages. They said, it's better for us to get married so that maybe we can have someone to take care of us. Then I said, no, this is not a solution. I have seen so many women in higher positions. They came from the village. So myself, I made up a concrete mind. I made up a vision. I said, I want to be someone in the future. I want to change the history of my family. Then I worked very hard. Before we go to school, our parents, they said, you need to go to the field and work. If you refuse, it means you are going to eat supper. Then we are doing like that. During the weekends, I was cooking small snacks with my parents, with my mom, and went to the market. And those that have let them get married, they said, you know, we told you, we better just get married. I said, no, I want to be somewhere. I want to be a graduate someday. Then after completing my second level, I was selected to go to one of the universities of Malawi to pursue a diploma course in business administration. Unfortunately, my parents failed to raise $60. I keep on waiting. I keep on reminding myself that one day I want to be a graduate. I was also selected to go to a certain college, Lilongwe Technical College, to pursue a certificate in financial accounting. By then, the fees was around $7. But my father and my 2 sisters were contributing for the fees. Later on, I had an opportunity. My sister from another family, she was living in a nearby town. I went to stay with her. I stayed with her for 2 months. Unfortunately, she passed away. Then I came back to the village. But my in-law was still supporting me. During the second semester, my in-law passed away again. I tell you, the life was unbearable to live. But I said, God, what is going on? I said, the more the change I encounter, I know behind the changes, they are success. So I keep on waiting. Keep on waiting. Some of my sisters get married. Some of my brothers get married. I said, no, I can't get married. And I can assure you, in my family, I am the only one, the only child who I managed to go to secondary school. And I am the breadwinner in my family. Because I made up my mind, I said, no. Yes, there is poverty, but other people in this country, they are living, they are well-to-do people. I want to be like them. Then, after completing my certificate in financial accounting, my father said, Lucia, we cannot manage to send you to complete with the diploma level. You better just find a job. I said, don't worry. Then I found a job. I started working. I said, I will never get married until I worked 10 years. I want to help my younger ones. I want to help my parents. Indeed, they were poor, but they tried their best to send me to school. Then later on in 2012, that's why I started working with Clinton Development Initiative. You know, everybody in this world deserves or has a right to live a happy, a healthy, and good life. Before Clinton Foundation project in Malawi, some of the farmers in our country, in our communities, were challenging with low productivity, low income, due to low yields, because of the poor seeds and the poor market. After the Clinton initiative, we are facilitating farmers' access to improved seeds, improved chemicals, improved pesticides. We also facilitate farmers' access to commodity marketing so that they can sell their produce at an affordable, at an attractive prices. What we are doing is like we group the farmers in groups in their communities. Then we train them good agronomic practices of growing maize, soya, granules, and the other crops. Then the farmers, after attending the training, they are managed now to live a happy life. I have also a story of a certain village called Menyawantu. Before our project of Clinton Foundation, people were living under the grass-touched house. People, they are failing to send their kids to school because of low income. People, they are failing to harvest more crops because of unavailable of good inputs. Then after the project of Clinton Foundation, things have turned around. Now, farmers are able to live under the metal or the iron sheet house. Farmers are able to buy push bikes they are using for transporting their farm inputs from the fields to their homes to their markets. Some of the farmers are able to buy maize meal, corn meal as an income generating activity. In the past, in the rural areas, typical areas, for a farmer to have a good house or maybe to plant, to install a maize mill, they said he or she is a witch. And some of the farmers, they can have money, but they say, then maybe I could be a witch in this community. But because of our trainings, we have managed to change their mindset. We have a lot of farmers. They have managed to buy maize mill, to plant within their villages, and now women, they are able to use those maize meal. But by then they were walking almost 20 kilometers to find a maize meal. So things have really changed.
Thank you, Lucia. That was so powerful. Anushka.
Preach. That was great. Okay, hi everyone. I'm really grateful to be here, and I just want to say most smallholder farmer panels are not as diverse as this. This is pretty awesome, and thank you, David, for representing the males. Okay, so just to get everyone engaged, raise your hand if you like to eat. Yeah, me too. And in developing countries, like Heather mentioned, most people who grow our food actually have months where they're food insecure, where they actually don't have enough to eat, or they skip all 3 meals. I've stayed with families where a family of 6 is sharing a small pile of peanuts that they've laid in front of the table. And so essentially, I'll tell you a little bit about what MyAgro does, and then our aha moment. so that we can all share in that. So MyAgro helps farmers save up for seeds, fertilizer, and training packages using their mobile phone. So this is without credit. It's helping farmers use their own money in their own pockets to invest in their biggest asset, which is their farm, to increase their harvest by 50% and increase their net income by $145 on average per farmer per season. And we're doing this with 50,000 farmers right now in Mali, Senegal, and soon Tanzania. And our goal is to reach 200,000 farmers by 2020 and 1 million farmers by 2025. So I'll share the aha moment because even today, 6 years on since I started MyAgro, the concept that poor people could save is relatively new, but the concept that farmers could save and want to save is almost unheard of. Because we often think about farmers having a cash flow problem, that they have money at harvest time, and then fast forward 9 months when it's planting time, they're cash poor again. So coming from the West, we think, okay, let's give them a loan. That's the best way to solve it. And it is a really effective way to help farmers invest in seeds and fertilizer. But right now, Dahlberg has shown that across Africa, Asia, and some countries in Latin America, only 25% of the needed finance for smallholder farmers is currently being met. And so we need a new way, and what I've recognized from spending a lot of time with farmers, and what they essentially told me was that they actually have cash. It's kind of similar to knowing that your kid needs to go to school in September and not being able to save for books or book bags or the things that they need. This is a knowable expense that they have. And so my background is in microfinance. I worked at Kiva and then was an early employee of One Acre Fund. And when I was in Kenya, I spent a lot of time with farmers trying to understand how they could repay their loan and how they could be successful. And one of the things that I started hearing from farmers over the course of my 3 years in Kenya was that the way they could be successful is if they could save their own money. But they didn't say it like that. They said things like, can I over-repay my loan for next year's loan? And then can I start paying my loan 3 months before I get my loan? Or my favorite was, can I get a loan for a cow, but I'll pay you for 2 years before you give me the loan? And so even though they were using the language of credit, what they were actually describing as their biggest need was savings, which makes sense. You can't get out of poverty unless you can build your assets and you can invest in your assets and make a return. We all know this. And farmers know this too. And so after doing some research across East Africa, West Africa, and South Asia, visiting organizations that had hundreds of thousands of smallholder farmers, what I started noticing was that there wasn't a viable solution for farmers to save their own money and invest in their farm. And so I decided to try it. I thought if it didn't work, I'd come back and go to business school. But luckily, it did work. I picked Mali because it's one of the poorest countries in the world, and I really wanted to prove that savings was a viable way for farmers to invest in their field. And the way that we do this is we have a network of 600 stores across Mali, Senegal, and what farmers can do at harvest time is sign up with their local village entrepreneur who markets MyAgro, and we sell packages of seeds, fertilizer, and training. And then they can, after they sign up for the package that they want to pay for next season, they can make small payments in the same way that you or I would buy prepaid minutes to top up our phone credit in developing countries. And so it's really simple, really intuitive, and I can talk more later.
Okay. Nithya.
Hi, and thanks so much for having us here. My name is Nithya Ramanathan, and I run and co-founded Nextleaf Analytics. So I wanted to tell you a little bit about how I got here, actually. I was doing a PhD in computer science, but my heart was always in thinking about how do we solve health and climate challenges. But my brain really loved solving the really sticky, complex engineering problems. And so for my thesis work, I got the opportunity to work in Bangladesh looking at arsenic poisoning in the groundwater. And my PhD was actually in what we now know as IoT, or Internet of Things. But back then, in 2000, it was sensors and analytics. And so I was basically designing these sensor networks to try to understand why we have arsenic in the groundwater and why are millions of people suffering from this poisoning in Bangladesh and Cambodia. And at the end of my grad school project, I got some papers out of it. And the women that I would stay with in the village were, year after year, were like, oh, we're so happy you're here. You're going to help us solve this problem. And I really kind of came to the end of it. And I thought, I haven't done anything. And so on my last trip, I raised some money. We consulted some geologists. It turned out that you could dig a deep well. And that could actually help the village actually just access clean water in a long-term way. And so, I raised, at that time, I think it cost about $3,000 to dig a well. So I did that, and, we felt great about it. And on the plane ride home, I remember thinking, wait, oh crap, how are they going to fix the well when it breaks? Why didn't anybody ask me this? What have I done? And that was one of my lowest moments, actually. I was just so baffled that as a community, as a sector, we thought that doing these one-off things of digging wells or, we thought that these were solutions, and they weren't. And so really starting to think about, okay, how do we start maintaining these things? Things like maintenance, one of the most unsexy problems out there. And really what I started thinking about more was, okay, I graduated with my PhD, and I started looking around and realizing there's so many assumptions out there, so many billions of dollars going to these large development challenges, really based on a lot of assumptions that we make, and not necessarily a lot of data or understanding about what's going on. So when my co-founder and I started Nextleaf Analytics, we wanted to try to take on some challenges, sort of big problems where having better information, having better data could help unearth assumptions, help drive and help iterate and help interventions really improve in a way that was going to be sustainable for the communities. And so amongst a number of challenges that we took on, one of them was vaccination. So vaccines, one of the most cost-effective public health interventions out there. But one of the big challenges is that vaccines have to be kept cold. Not too cold, because surprisingly, in addition to getting too warm, actually if you freeze a number of different vaccines, they will also lose their potency and not work. And so studies in India have shown that, possibly over 60 or 70% of vaccines are partially ineffective by the time they reach children, and that this is a big, essentially contributor to the several million deaths that happen from vaccine-preventable diseases that we could completely avoid if proper vaccines reach children. And so one of the big assumptions that's out there that we've helped change, that 10 years ago when we first got involved, was let's just buy new fridges. Let's buy everybody a new fridge. And there wasn't a lot of data out there, we found. So we started taking cheap cell phones, putting sensors on them, putting them in clinics, starting to work with the Gates Foundation to try to understand what is the extent of the problem and what are the real barriers to getting to proper cold chain operation. And so, we started discovering that actually, again, better maintenance of existing fridges could actually go a long way to helping vaccines reach children at the end. And so, we developed a much more scalable sensor. 15,000 of our sensors were sold to the Ministry of Health in India. We've installed them in about half of the clinics across the whole country. So our devices are now, these are small, low-cost sensors. They go into fridges. They send real-time alerts to nurses. And more than that, the data helps governments really think about exactly how to be thinking about today as well as planning for tomorrow in terms of the refrigeration, the vaccines, the distribution. And so our sensor networks across about 7 countries now are protecting the vaccine supply for over 12 million babies a year. So this is about 10% of all babies that are born. But really we're thinking about not only how do we take the data and help governments think about the vaccine cold chain, but how do we now help them start thinking about other infrastructure as well within the health system and reaching 20 countries by 2020 to do that. And I'll say one other thing here, which is that we've started learning more about agriculture and produce, and as Heather mentioned in the beginning, how statistics vary, but up to perhaps 50% of produce is lost in a number of countries, in part because of lack of access to refrigeration. So we thought, oh, great, we'll take what we've learned in the vaccine cold chain, and we'll see if better cold chain and refrigeration can help reduce the loss of produce. And it's been really interesting because, and I'll admit this here, we made this assumption that, oh, refrigeration, that can help solve the problem. And it very well might. But one of the things that we've learned along the way as we collect data, put sensors, working with farmers, is that refrigeration is not necessarily the only answer now, and that farmers have helped us understand, oh, there's lots of other storage techniques that we could take. And as we kind of learn more, one of the things that we're interested in as an organization at Nextleaf is how do we start collecting more objective learnings? How do we start sharing these so that as a sector, we're not only kind of learning what assumptions we're making, but we can start also sharing what's working, what's not working. Something that works in one sector may not always work in another sector. And how do we really kind of move forward as a community? So thanks again for having us.
Thank you. This is so inspiring. We have these, yes, please. When you see these seemingly intractable problems, it seems like the way we are going to solve them is new technologies, new approaches, testing them out, what sticks, what scales, and it feels like you all are doing that exactly, which is very exciting. Dave, why don't you tell us what ideas are you excited about these days, including as it relates to mitigating climate change?
Well, I mean, I think it's building off of what Nithya was talking about is that for me, what's exciting is when you get in the field talking, and Anushka was mentioning this as well, when you start talking with farmers and understanding their problems, it's quite exciting to understand just how, I would say, poor the data is right now, just how poor the understanding is of what works and what doesn't work. So farmers in Uganda, for example, when they get access to inputs, if they do get access to inputs, they have very little information on whether that's actually what they think they're buying. There's been studies showing that the fertilizers they buy are often diluted by 30 or 50%. The seeds that they buy are nothing close to what they say that they're buying. So there's just a real lack of information then. And then you talk not only to the farmers, but the people working with the farmers, and they really have very little understanding of just what works and what doesn't. And they have very little ability to even understand how do you go about learning what works and what doesn't. And I say all of this as a way of sounding excited because I think it is quite exciting, the possibilities now in terms of very quickly tracking the performance of systems. So the sensors in cold chain is one example of that. The one example that we've been working on a lot is using the new generation of satellites. So there's a bunch of companies locally and elsewhere. There's also a bunch of public sector investment in satellites where you can now actually track individual smallholder farms in ways that you couldn't even dream of doing 5 years ago, say. And so we've been trying to use that to actually track at the field level, what is the performance of individual fields over time. And again, these are farmers where if you go, and traditional approaches is you go and you ask them about their harvest, and they really have very little idea. If you really probe, they don't keep very careful records because they're just struggling to get by. But once you have this ability to very carefully track what's going on, you open up all sorts of possibilities, including helping NGOs like MyAgro or One Acre Fund or others, helping governments understand which of the 100 things that are going on right now are actually working well. And so instead of taking 10 years to figure out, oh, this is something that actually is really becoming popular, you can learn very quickly that these 9 things aren't working, which is usually the case, that 9 out of 10 things aren't going to work for some reason, and the other one is working. And so that ability to learn quickly, I think, is extremely exciting. I think there's a lot of analogous stuff going on the genetic front. So in terms of developing new technologies for the seeds, which is really important for all these agricultural systems, there's a whole bunch of technologies, including CRISPR and others, coming online, which is really speeding up the learning cycle in terms of generating new information. And what that means is that as you lower the cost to good data, that means that you are able to make progress not just in the high-end, very commercial systems, but you're able to go into the types of systems, the types of crops that the poorest smallholders are working on. And so the gap between the technological capacity in the real commercial systems versus these more smallholder systems, I think, is closing pretty quickly.
Terrific, thank you. I think I'll follow up with that. Anushka, I want to ask you, so we've talked about farming as a primary source of food and income for Africans and provides up to 60% of jobs, so we've covered how important this sector is. And we're going to have to scale up and increase it, right, as populations are increasing. Should we continue to focus on the smallholder farmer in the near term, in the medium term, in the long term? With increased urbanization, are there other things we should be thinking about, perhaps vertical farming? What are you seeing as trends for the near and medium term?
Well, I'm biased on that one, so yes,
Good,
we
let's
should
hear it.
focus on the smallholder farmer. I'll just give the case of Mali, of why. It is rapidly urbanizing. It's gone from 1 million, Bamako, the capital, has gone from 1 million to 2 million in the last 3 to 4 years, so it is very quickly urbanizing. However, when you look at the overall population, it's 15 million now, and it's going to double by 2030, and estimates are that it's going to double again by 2045. It is growing very, very quickly, and most of those kids that are going to be born in rural areas. So these are kids born to farm families who will most likely be farmers. The opportunity that's in front of us is that if we can increase production in these rural communities, then we can keep some people still in rural communities, and they can start feeding the growing urban centers. So they can move out of poverty in that process and feed the local markets that exist, which is much easier than trying to export to the US or Europe, for example.
That's helpful. Lucia, I wanted to ask you, we've talked about the fact that farming is this primary source of food, and also that women produce the bulk of food. Women are smallholder farmers too, and they are often locked out of land ownership, access to credit, except now they're not, and productive farm inputs, et cetera. What role does gender equity play in the work that you do for the Clinton Development Initiative?
Thank you. In Malawi, Clinton Development Initiative, we have trained close to 105,000 farmers. And out of this figure, 40% are women. We tried to mobilize the community for the women to be leaders in their crops. Because of culture values, most of the times for a woman to stand in front of men or some leaders, it was like she is misbehaving. So we tried to train these farmers, to train these women so that they can stand on their own. There is a certain lady called Lucia Banda. In 2012, after receiving the training of soil agronomy, she managed to plant the soybean. Then she harvested a lot of bags, almost over 50 bags of 50 kgs. Then after selling the soybeans, she managed to buy iron sheets, she buys solar system, and now she is living in the house with electricity, but in rural areas. So because of this Lucia Banda, what Lucia Banda has done, most of the women now, they are joining the clubs, because we believe that if these women are empowered economically, it means things will be okay. We have heard a lot of stories concerning wars. During wars, men can run away and leave a lady with children. So we normally encourage these women to work very hard, to stand on their own, so that they can help the young ones, they can help their children to live a better life. So in our programs, we focus much on empowering women farmers.
That's terrific, thank you. I think an important question to ask at an event like this is, what advice do you have for philanthropists, given your perspectives, whether you're based at a university, on the ground, at a social enterprise, a nonprofit? So Nithya, maybe I'll start with you, and could you think about too, what are you seeing that is replicable and scalable and promising? We've talked about kind of the big ideas we're excited about, but what is a little further down the pipeline? What are you seeing that's been tested and you're feeling positive about?
Yeah, and actually both of those questions kind of come to something similar for me. As we think about next stages, not only for our organization, but as sort of the vaccine sector and the health sector in general, one of the things that we're seeing that I'll echo from the past panel is really thinking a lot about private sector partnerships. And this is a buzzword, so let me say that again, but really kind of working with companies in a way that's business aligned. So one of the things that we found that really worked for us is we had a partnership with Intel. This is just one example. So some years ago, somebody at Intel had approached us and said, hey, you know, we have this wearable technology. We're interested in thinking about new markets for it. You guys work in air pollution, another area that we work in. And so they wanted us to help them kind of co-develop this product. And you know, we weren't really sure where it would go, and we sort of just took it as an exploratory opportunity. And before we knew it, over the last roughly 4 years now, we've co-developed actually 2 products with Intel. One of them was actually the product that we took to scale in India and is now scaling across a number of countries in East and West Africa. So we're pretty excited about this ability to kind of work with larger industries and businesses that maybe are established in one area and have quite a bit of expertise to bring to another area. So now we're starting to work with a number of other technology companies, including Amazon, as well as fridge companies. And none of these relationships are philanthropically based, but rather sort of based in this very mutual respect relationship where we say, hey, you know, we see some of these problems. We know how to take technologies and scale them in a way that's extremely socially impactful. We prove it out. We work with the WHO and the Gates Foundation, you know, to run the studies, ensure that impact's happening. But you guys know how to engineer things at scale, and that's pretty fantastic when we can figure out alignment. And I guess moving forward, one of the sort of potential opportunities we're seeing is sort of possibly maybe different deployments of philanthropic capital. And you know, markets are not always the solution, but sometimes a better, stronger market can be a solution or can be part of a solution. And often we're seeing more and more companies that are saying, hey, we want to be part of solutions. We want to be part of solving some of these big challenges. We just don't know how to do it. We don't really know how to operate in Tanzania. We don't know how to operate in a number of countries where, you know, we think our technology could help. And so as we think more about helping to grow and strengthen these types of markets and ensuring that communities are strengthened, you know, Deepamal spoke very passionately in the last panel about how we need to be building trust and you know, community strength. And that's exactly right. So it's not just about bringing a solution that works in one country to another country and saying, great, go at it. It really has to be community driven. It really has to be sitting down with farmers and nurses and all of that. And that's where organizations like ours, you know, that is the DNA that we bring. And so just as we think about different types of deployment of philanthropic capital that can sometimes help with some of the early stage, high risk exploration, you know, use case development, really understanding what are the impacts, how to deliver. It can be an interesting opportunity to start engaging bigger companies earlier on as part of that exploration phase, so that we can start helping companies also build better business models around being part of solutions on the ground in a number of the countries where we work.
That's terrific. And I have to say that at UC Berkeley, we're seeing a similar trend. I don't know if you would call it CSR 2.0, 3.0, but that there's such a role that the private sector can play that's not traditional CSR kinds of things. For example, manufacturing. I mean, at a university, you come up with a novel technology, a widget, maybe you can make 20 in your lab and do some tests with that. But at the next stage, when you need 300 of them to do the next stage of a trial, or even more than that, there's a gap. Where do you get the funding for that, you know, to prove the case, to then really get the funding? And we see private sector companies really coming to the table in a way they didn't before, where this is something relatively easy for them to do, and they're learning from the processes, they're learning about developing economies, and it really is that mutually beneficial experience. So I would second that. David, do you want to tell us advice for philanthropists from your POV?
Well, I mean, I do agree that the private sector is really engaging in a way that is very encouraging. I think at the same time, it seems in many situations, in many countries, the public sector is disengaging in many ways. it varies obviously where you are, but look at our own country. I mean, the amount of investment in basic science has really gone down. If you look at the international agricultural system that has historically been really supported by philanthropic donations, the amount of investment in basic science there has really gone down, and they spend a lot of their time just trying to get the basic necessities for what they do. And I would say that it's important to remember, at least from my perspective, in the history of improvements in food security, you can trace them back, and even in this country, you can trace them back to public investments in science. That even the great seed companies of this country don't really do the basic science. They're really building on what has been done. And if you look at a lot of the poor areas of the world, whether it's wheat systems, rice systems, maize systems, a lot of the basic technologies that are going in are really based on good, sound investment in basic science. And I worry a little bit as people want to see the real impact and measurable impact at a very clear timescale, that there is a loss of the appreciation for how important it is to make those long-term investments in sort of the basic technological progress that then goes on to be scaled up by the private sector. I think we forget that, and I think I can't help but think back to the panel this morning about the importance of separating fact from fiction. I mean, I think these are all very related issues in terms of basic appreciation for the importance of actual evidence and basic appreciation for investing in new things and new science, and that's going to be, I think, as important as it ever has been. But there's, I think, a loss of investment that I think the philanthropic community can help to fill in.
That's great. Yeah, I think the importance of remembering that the innovation trajectory is not a short one is something we can all be reminded. Anushka, did you want to say things that you would recommend to philanthropists?
Sure, and I'll talk about what I'm really excited about mapping and machine learning, and I think that has the opportunity in the next 5 to 10 years to completely transform agriculture in Africa, and that is incredibly exciting. For organizations to be able to take advantage of that, we need to build our technical capacity in-house or through consultants, and so I think there's opportunity to fund capacity building on the technology side so that we can take advantage of all the data that's coming in. Because I'll just give some examples of what this means when I say it can transform. There's no viable crop insurance program in Mali. And part of the reason is that there's a dearth of data. And now there will be that data. And now we can talk to insurance companies in Kenya to provide coverage in Mali for smallholder farmers that never was accessible before. And that's incredibly exciting. And it's proven that one way to get farmers to invest in seeds and technology that does exist is to insure it. Another example is fall armyworm is a new pest that came over from Brazil to East Africa and is now in West Africa. Last year, government offices in Mali took 6 months to declare officially that fall armyworm exists because all the reports were anecdotal. So people were saying, oh, I saw it on this farm and I saw it on this farm, and the right person in the right office didn't see it on their farm. And so, through GIS, through satellite mapping, we're able to take what is currently a black hole and make it visible so that people in governments, organizations can make quick decisions. But in order to take advantage of that, we need to invest in capacity on the technology side, like I said, and then human resources. I think there are a number of really great organizations that are investing in leadership and building a new cohort of leadership across the continent. But in order for great organizations to scale, we need great leaders, and then we need really great middle managers. It's the unsexy kind of training and investment in people that is going to help organizations like Myagro and others scale.
Thank you. Lucia?
Thank you. My advice to all the therapists is like, this time there are a lot of, can hear stories of corruption, mismanagement of funds and the like. So for them to build trust with the organizations they are funding, first of all, I think before the funding itself, they need maybe to go to send a team maybe of 2 or 3 people to go and evaluate the project before the funding. For example, we are implementing a certain project. We are receiving funding from ARAS for Green Revolution in Africa. Before the project started, the team came and evaluated the situation. They took pictures. They have the stories with the farmers. Then after 2 years of implementation, after sending us the report, the successful stories and data, they said, no, we have seen the report on paper, but we want to come again to verify that is this true? It's really a farmer has managed to buy maize meal. They have managed to buy iron sheets. So we welcomed the team. It was a team of 25 people. They came and visited the area. They started chatting with the farmers, and they are sharing ideas with the farmers. Farmers were telling them stories, this and that. Then they have confidence that, oh, okay, yeah, this is working. So I'm also encouraging all the therapists to do likewise. They can come into the areas, in the rural areas, to verify for evaluations, what they are doing, what we are going to do, what we are planning to be our impact or the outcome and the like. Then after 2 or 3 years, they can as well come again to verify so that they can have confidence, they can build trust, they can continue helping other organizations. That is.
That's great. One question I have for any or all of you is back to this theme of the hard questions and the intractable problems. What are some problems in food security or even health that have important unmet needs where we don't have viable solutions yet? What are some of the problems that you're seeing that maybe you can pose to us all that we think will have an answer, I don't know, in a decade or something that you're grappling with today?
Well, I'll just bring up an example I briefly mentioned before, but in a lot of the smaller systems, I think this issue of trust is important, and I think the ability to sort of very quickly diagnose the quality of what they're being sold is going to be, I think, a real enabling technology for a lot of trust in the system that has been eroded over years of not getting good quality inputs. And I don't see, and this might just be, it's not an area I'm actively working, but I don't see the technologies to do that in a very cost-effective way. Similarly, like with this country, for example, in the US, we have great ability to customize what we're telling farmers to do based on soil tests that they have. The ability to get very cheap and accurate soil tests in smallholder systems around the world is something that there's been some development on, but it hasn't gotten to the point where I think it's really a plug-and-play type of thing that's going to be, well, I haven't seen it that need be met very clearly.
That's great. We are at UC Berkeley funding a team that's part at Berkeley and part at San Diego trying to figure out the first national test of counterfeit maize in Kenya to really see the data. So here we are, we're saying we need these technologies to say how good it is, but we don't, like you said, we don't have the data to show exactly how much is counterfeit and how far away from certain cities does it get more, you know, does the data change? So I think it'll be important to see what, now that we have all this new technology we're working with around the sensors and the satellites and et cetera, it'll be interesting to design a new set of problems once that first round of data is in. Did you want to say something, Nithya?
Yeah, I can jump in. One of the things that we've been seeing is in the health systems across countries, actually there's quite a bit of some types of data. And of course, quality varies, any data set that you look at in any country, but there's quite a bit of data that does exist. And one of the challenges that we're seeing is that there isn't a lot of working together. And this also echoes something else that came up in the last panel that I really resonated with, which is silos. You know, I think for a number of reasons, you know, in our sector, the development sector, there's siloed approaches to solutions. And this happens for a lot of reasons. Funding may flow this way, organizational capacity goes this way. You know, there's lots of reasons, but increasingly with data, we're seeing that the data sets are siloed. And this is a real problem, and there's no excuse for this. And so this is one of the opportunities that we're really seeing in this sector is actually, hang on, let's not generate a lot more new data. Let's look at what the gaps are, and then let's talk about how we bring these together to answer really specific questions. And we find that when you start with the question and then try to use the data to figure out the answer, it then naturally, organically brings everyone to the table to say, okay, well, if I want to solve this question of how many maintenance technicians do I need for next year, okay, well, I've got this data set actually, and the ministries of health are also very forthcoming with their data and their time and resources. And we kind of, the data, when you start bringing it all together, really starts aligning everyone, because everyone's very attached to their own data. It's like their child. And so everyone's like, oh, wait, use my data to help answer this question. And all of a sudden, we're all starting to work together in the Ministry of Finance, and all the ministries are more motivated to work together. So this is a real gap right now, but a real kind of, I think, potential challenge that as we start thinking about more data and information, also thinking about how do we integrate all of this to use it to answer the questions in a much faster and smarter way.
Yeah, and it's exciting to see the commitment from academics these days to share their data more. So there are great new programs on transparency in the social sciences and Open Science Foundation and other online repositories where we're now, depersonalizing the data, but being able to share it. And a lot of grants now are requiring that the data be shared. So this is a great move, I think, towards more people being able to use the data. We are being encouraged to ask the audience if anyone has any questions. So if you do, raise your hand and we will send around a microphone to you. I'm trying to look out here. Does anyone have any questions? Just the small questions about food, hunger. Yes, Jane, please.
Your last point was really powerful, and this is a real change in philanthropy, this notion of requiring, as the NIH does, that when you publish your results, you also publish your data, and I assume in machine-readable form. Mm-hmm. Tell me who's driving that change. I know Bloomberg does this. What funders, what foundations are pushing for open data related to the research that they support?
Yeah, so I can speak to my UC Berkeley experience. So I have to give credit definitely to the Gates Foundation and also to USAID, who they've been very impressive in terms of funding more academic research and then figuring out how their open data policies can actually work and be realistically implemented. And they were very willing to work with UC Berkeley and a number of other universities, part of this higher education solutions network they have, to say what's more realistic that we can get out of the door. And so it was a great back and forth, I have to say, with USAID to figure out what their open data policy will be. So I think it's still changing, but I think a lot of credit goes to the Gates Foundation. And then again, USAID is what I've seen. Do you want to speak to some?
I can talk about that on the sort of implementer side of things as well. I think the Gates Foundation's been a big driver along with USAID actually on the intervention side. So if you take Tanzania as just one example, so both Gates and USAID have been working together on something called the Health Data Collaborative. And exactly as you were talking about, Jane, it's about having data be machine readable, having common APIs, et cetera. And they've really, I think, taken ownership of this in a way that has been really exciting. One thing that I'd love to see more of is more engagement with the ministries of health and the governments. And this is just sort of the next evolution and the next step in the thinking of it. But what I'll say that I think is working really well is that Gates and USAID are taking ownership and saying, okay, we're bringing a lot of the money to information system development. Now we need to sort of provide resources and the drive to say, okay, we need more interoperability in terms of defining these. So I'm really excited about that. And one thing that I hope and am pushing for and expect to see is really much more engagement and capacity building, as Anushka was talking about, in terms of that technical expertise for governments as well. Because the local talent is obviously there in all of the countries where we work, and it's more just about supporting the ministries to kind of tap into their local talent pools and help kind of guide what that should look like.
There's a question.
Thank you. Christina Mann from Let's Do It World. I have a question about fair trade certification systems and fair trade systems. How much, in your opinion, do those systems and certifications enable food security in the communities that are producing food? Are we doing the right thing when I insist on buying fair trade tea, coffee, and sugar and bananas, or is it nothing? Thank you.
That's a great question. Who wants to take that one?
Okay, you're doing a good thing. I'll say that. I don't work with, so fair trade, I'm not as familiar with it because we work with smallholder farmers that are not connected in value chains, in tight value chains, or loosely connected. And so a lot of those farmers are, people who grow coffee, cotton, cocoa, and so they're in systems that have a lot of credit and financing available to them, and obviously fair trade also gets them a better price. So it is a good thing. But that represents about 7% of smallholder farmers globally. 93% are in loose or no tight value chains at all, and so those are the farmers that my agro serves.
Yeah, I think those statistics are important. We have time for one more question. Anyone else? Do we see any hands? Great, they're in the back.
Thank you. I'm Stephanie with the NDI. I was interested, David, in what you said about the lack of investment by governments in basic science at the moment, especially the trend we're seeing in this country around science not being respected as it should be. So I'm curious to hear what you might have to say about the roles and responsibilities of philanthropy and public funding to basic science, to biotech, to areas that are about the public good, so presumably some kind of government responsibility. So where and when should philanthropy be stepping in, and where and when should philanthropy be pushing for governments to take responsibility in those areas?
It's a great question.
Yeah, that is a great question, and I don't pretend to know all the answers. I think that it is true that a lot of governments have not met their commitments to invest in agriculture. A lot of the African countries in particular, they committed to 10% of their GDP being invested in agriculture, which is historically what you've seen is needed to really kickstart food security, and a lot of them haven't met that. But I think that both USAID and the Gates Foundation have been constantly rethinking which countries are they going to invest in for these various reasons. I will say that one thing I think philanthropists often do poorly is trusting scientists themselves. In other words, if you look at the budgets of a lot of the major scientific organizations that work on food security, that over time you've gone from basic programmatic funding being something like 80 or 90% of the budget, where it's up to the scientists to decide what is most needed at the time, where are they best putting their resources, to something that's more like 80 or 90% of project-based funding, where it's the foundation saying, we think that this is the problem that we're going to solve, and we want you to work on this very specific problem, whether it is food waste or whether it is this particular crop in this particular type of, say, biofortification approach. And the problem with that is I think that it's not nimble enough, it's not responsive enough to the scientific opportunities that that the scientists can, in a programmatic funding, can pursue. And I think that that for me, working with a lot of collaborators around the world in these scientific organizations, that's probably the biggest frustration that I've seen. It's of course the lack of overall resources being devoted to these problems, but it's the insistence of, I think, philanthropists to have control over what science is being done for reasons of, reasons that make sense, accountability and measurable progress and things like that, but that very much go counter towards, I think, the historical experience, which is that all of the green revolution technologies, for example, or a lot of the great technologies that the private sector are now using came out of scientists deciding what should be worked on, and not program managers or philanthropists.
That's great. And I have to add to that that I think there's a new wave of matchmaking events that I've been seeing happen. So I know the World Bank has been putting attention on this, but basically how are we coming up with the problems and how can we work together to come up with the problems that we want to solve? So get the scientists in the room with other people and with the implementers, et cetera, and reframe the problems and figure it out together. And then we were talking about this earlier, Nithya and I, have small grants that are associated with those matchmaking events. We can't just have events where we're talking about the problems with researchers and then we hope that everyone, promises to follow up on a call, in 2 months and 5 months and whatever it is. But having micro grants that you tie to new questions to kickstart that research is something that we're seeing again at universities, but also the World Bank and USAID is really working on framing the problems with scientists. And so I'm hopeful that there will be a mix.
I think that's promising. I think that it is a way of getting the system more science-based. But I think that fundamentally you have to look at the incentives that people face. And with scientists, I think that you have to at some level be comfortable that the incentives they face are very much consistent with the goals that you're trying to achieve. That scientists are not really, despite what some people try to say, the scientists are not in the they don't even have the organizational capacity to perpetrate great hoaxes and just take a lot of money and not do anything with it. All the incentives in science are to innovate, to be known for coming up with a solution, to actually not waste a lot of time on a dead-end type of project. And if you have those incentives systems in place, why add on top of those additional layers of reporting and constraints that really mean that most good scientists now spend 20% of their time actually doing science?
No, it's a fair point. Well, this has been incredibly inspiring, listening to you all grappling these problems and figuring out how we feed and keep healthy over 7 billion people in an environmentally friendly way. So thank you for being here, and I'm excited to see what technology will bring to us all through your organizations and research in the coming years. Please join me in thanking our panelists for being here today.